let me now welcome on stage Vanessa Ding. She's the Deputy Director from Talent at SG Innovate, as well as Akiko, Innovation Practice Lead, Cloud Consulting, Google. And then Dr. Siddharth Katru, Medical Director and Head from Prudential Assurance, Singapore, Kidit Affable Partner, and EY, and then Pauline Tay, Director for NHIC. So once again, there's a QR code that's located at the top right-hand corner of the screen to share. You guys can enter it to put in your questions for all of our panelists. Vanessa, please.
Thank you very much. Thank you everyone for your, I know I'm between you and the refreshments, so we make sure this is going to be interesting and keep you on the toes. So thank you for the organizers for inviting all of us to this panel. I really appreciate that. It's really my privilege today to introduce my panelists to you today. They represent the provider, your payer, your pharma general outlook from Kidit, and obviously the tech company. We have Akiko here with me. While we know that innovation in healthcare holds potential, to improve patient outcomes, to reduce costs, as well as addressing some of the pressing needs in the clinical space. While innovation helps in advancement, it always brings about disruption to your current standard of care. And without further ado, I would like my panelists to introduce about themselves and also talk a little bit about what innovation they care about and what their organization is focused on. We'll start with Pauline.
Oh, okay. I was just thinking that it was start with Akiko.
You keep looking at me, so I have to start with you.
Darn. Anyway, I'm glad that I'm not the last between you and networking. But so anyway, I'm Pauline. I run the National Health Innovation Center. This is an entity that's responsible for working with all the public health clusters. This is both hospitals and clinics. To develop innovation and technology. So this can be from the clinicians or they can be with the clinicians. So we do encourage collaborations, but we also encourage co-development, co-investment, and hopefully co-distribution. Yeah. What do I care about? We're supposed to say what sort of innovation we care about, right, Vanessa? Okay, so for us, we are actually tech agnostic. So good news to all of you who have all those ideas, right? We don't really focus on any particular tech. We focus on meeting a clinical need. So I think during that health buzz thing, the last, was it Cayenne? Someone said something about you've got to find the need, right? People will pay you if you meet a need. So same thing. We always start with a clinical need, and if that clinical need can eventually find a commercial pathway, someone will pay for it. It will then eventually become affordable, accessible, and sustainable. So that's what we care about. Thank you.
Good afternoon, everyone. Kidit Affable. I'm a partner in EY Parthenon's Life Sciences and Healthcare practice. We do advise big corporates, pharma, medical devices, etc. But also try to put on another hat. So in a previous life, I was a commercial leader in a few pharma companies and was also leading business model innovation. So that's two hats I wear. And just building on from the discussion of what excites us in terms of innovation, one of the things I was reflecting on is it's the 20th year anniversary of the Human Genome Project. And that's amazing, right? So, and there are a few things I just want to pick up from that. That Human Genome Project ushered in personalized medication, and I think Hugo, when he was showing Cayenne a while ago, you can see what we are achieving today. And really, if you think about it from 4 dimensions of personalization, we've seen a lot around preventative care, number 1. We are looking at models on earlier disease interception. So identifying diseases before they happen and intervening in the right ways. The third thing is we're obviously improving paradigms and treatment of care, going all the way now to driving the next wave of curative models, and hopefully including cancer, right? So just as an example, you can now take out your own cells, program them, put them back to fight cancer cells within the body. So that's the first one, personalization. The second thing I want to draw on is when the Human Genome Project started, and they started sequencing DNA, it cost $2.7 billion to sequence the DNA. You can now buy a sequencing machine for a few $100s, and you can get the results in a couple of hours. So the speed and scale, and I know somebody said earlier we're not doing it fast enough, but the speed and scale has changed dramatically already. And what excites me is there's a need to continue to push these models forward. Now, one thing hopefully that we can address is technology is great, but there's a lot of problems around accessibility of that technology, paying for that technology, and measuring outcomes of that technology. So just something to keep in mind. And maybe the third thing I just want to pull in from that Human Genome Project and learning from that was collaboration amplifies innovation. So one of the things they did afterwards was to put a model in place where DNA sequencing can be easily accessed and is in open platforms. Can we do the same as we talk about the advancements in data, AI, and how can we build the right ecosystems? There's still a lot to do. When the Human Genome Project started, it mapped mostly Western genotypes. Today, hopefully, we're going to move that forward as well and map other types of genotypes and really look at Asia for Asia models. Maybe I'll leave it at that.
Thanks, Kidit.
You seem to be doing everything in the world, so I'm really scared I'm not doing anything at all after listening to you. But good afternoon, everyone. My name is Dr. Siddharth. I am the medical director for Prudential Singapore. I also lead Prudential Singapore's health insurance or medical insurance business, and I'm responsible for delivering that sustainability of that portfolio for Prudential Singapore. Actually, a very interesting topic, and maybe I just look at it from a different tangent, in terms of what does innovation mean for a health insurance company per se, and specifically for Prudential. If you take a few steps back, maybe go back 15, 20 years, that's it, no more than that. The traditional role of an insurer was of a payer, which actually means that somebody buys a medical insurance policy or a life insurance policy for that matter. Then you just forget about that document, you just forget what you have, because at the end of the day, it's a piece of paper, it's an abstract promise that if something happens, I'll deliver something to you. And then at some stage in life, there's a hospitalization or there's a death, and then this entity called the insurance company just comes in the picture and either pays the claim or the money, whatever is due, or doesn't pay, citing certain reasons, and that's the end of this relationship. And that's the end of this relationship. That's what traditional insurance has been all about. But in the healthcare space, what we are really passionate in Prudential today is we're trying to transform this concept completely. We are trying to bring in solutions, and many of them are digital solutions. And don't get me wrong, I'm not saying that we're trying to build digital health or something like that. Because at the end of the day, I am of the firm opinion that there's no term as digital health per se. There's digitally enabled healthcare. That's my understanding of healthcare. So we are trying to reach there, and how we are trying to reach there is basically, we are trying to build this entire ecosystem, this entire journey from onboarding a customer, what you call a partner, healthcare, your policy holder in other words, from the stage of onboarding, how do you make it more seamless by using digital technologies? To the stage when healthcare or a life insurance policy is issued to the policyholder. To the next stage where you actually want to be engaged with this person, because you want to move away from the fact that you only interact with your policyholder, your customer at the time of death or hospitalization. What do we do more to be constantly engaged with our partner, which is our policyholder? And that's where the concept of using digital technology as an enabler to have healthcare touchpoints all across the value chain. And just in the previous session, I heard one of the speakers talking about, it's not healthcare today from an insurance perspective, from a payer perspective, and it's going to be amplified further as we move along, is not about paying if a person is hospitalized. The future is going to be, how do you keep a person out of the hospital? And if that's the case, and we saw some presentations, we heard some speakers talking about that, if that's the case, you would need constant interaction with your policyholders from a touchpoint perspective, and that's where the healthcare ecosystem comes in, and that's where a digitally led healthcare ecosystem comes in. And subsequently, if now still in spite of your best efforts in the future, there are people who will still need to be hospitalized, and once they are hospitalized, how fast can your service touchpoint actually deliver on what you have promised? How can you place guarantees of payments with the hospitals? How can you use AI technology, OCR technology to actually assess those claims and make the payments fast, whether it's to the healthcare provider or whether it's to the customer? So on and so forth. How does your customer center interact? How do your chatbots interact with your policyholder? So there's a huge space here where Prudential is really looking at in terms of using digital technology, using AI, using innovation, and reaching a stage where we are no more the traditional payer that you hear about us once at the time of hospitalization or death, but you hear about us more often, and we know more about you in terms of your health and how your health is progressing. So that's where we are, and that's my passion as well.
Thank you, Solar Sweetheart. Akiko.
Hello, everyone. So my name is Akiko Taguchi, and I'm going to be the most boring person on this panel because, really, frankly, because first of all, everyone knows who my employer is and what Google does. Second, I am merely one employee out of 120,000. So, I'm going to be the most boring person here. But what do I do at Google? I help. I put on, business model lens to help companies innovate together with Google. So this means for a startup, I might be the startup advisor, helping them along the journey of, testing the business model, even helping with pitches or pitch practices or fundraising, or, connecting them with my ex-colleagues in the VC/PE world. Other than that, I help the large enterprises that, are Google's customers. And these companies, believe it or not, often have problems, dealing with, for example, disruption or the issue of how to innovate and act on the new young ideas that are coming, even within their own organizations or when they collaborate with, startups. There are a lot of cultural issues, right? So personal passion around innovation. This is a hard question to me personally. It's kind of like, why innovate? It's the reason why we live. For me personally, it's boring to do the same thing, every day. And if you can do something new and, solve a problem that is really meaningful and impacts as many people as, possible, or even one person really, really significantly, that's great.
Thank you, Akiko. So we talk about consumerism. Patients are getting smarter these days. We are all on somewhat our phones, apps, and really the shift for traditional healthcare delivery model has changed. Our panelist has alluded to that. Maybe a question for Dr. Siddharth first. From a payer standpoint, collaboration is important. There's always a cost that you have to balance. And beyond the financial aspect, how do you think you can implement innovation through partnering with different stakeholders? And how can that come about, and who's managing that cost?
Yeah, I think that's a very good question. And the fact remains that we don't have a 100% solution to this right now, as in we don't have the full answer to this. You see, all these digital partnerships, all these getting these seamless partnerships on board through various digital mechanisms, they're just developing. It's not that we had them for the last 20 years or something. Probably the last 4 or 5 years have been something that's been very active. So when we enter such partnerships, or when we look at where we could really meet people who are of the same mindset as we are, I think the key for us at Prudential is, how do we make this a quality offering for our customers / policyholders, right? So number one box to be ticked is, right, it's whatever we are partnering, whatever offerings we have, whatever offerings we want to bring on board, they are basically, ticking the box of quality healthcare. Now, what that also means to us that, and going back to the point you made around the financials around this, well, to be honest, yes, they do play a key role at the end of the day. Once you've ticked the box that this is quality healthcare, but at the end of the day, if this is being delivered to our customers, look, there are no free lunches. Let's put it like that, right? if all these things are coming into play, somebody somewhere is paying for that. I'm being very honest about it. That's how it works, right? So if somebody has to pay for it at the end of the day through whatever mechanism, subscription, premiums, whatever you call it, is this quality healthcare at affordable prices? So this is the punchline that actually we follow. And based on these two boxes, then what is the value proposition that's being generated out of this? I'll share just one very important example with you from Prudential's perspective. We sort of were looking at a digital healthcare ecosystem a few years back, and then we saw some systems in the market which actually were focusing on your fitness, how many steps you're walking around, or how many steps you walk per day, and then if you walk X thousand steps a day, then I give you something, and nobody knows who's been walking those steps, right? But that was something new to the market at that time, and we said, wow, this is something. But then was that a complete healthcare ecosystem in managing the health of that customer, of that individual, of that consumer? And that's where we started thinking more. We said, if we have to have a digital platform for our customers, we need to have everything there. And when I say everything that a person would need from a healthcare perspective. So today we have something in the market which is called Pulse. The app, the healthcare app, is called Pulse. Now, when I say it's a complete healthcare proposition, it's because you have access to everything that a person needs who is healthy and a person needs who is unwell as well. So you have access to telemedicine, you have access to health screening centers, you have access to consultation booking, booking specialist appointments. You have access to symptom checkers, which actually, I wouldn't say they are doctors per se, but they are symptom checkers which are based on a doctor's brain, as in we say at the back end is the doctor's telling you what exactly you could be suffering from. But still, with a rider, that asterisk that it's not a doctor, right? But still, it's a triaging tool that really tells the person, the consumer, what could be wrong with his or her health, right? So that's where we want to be, in that space, the healthcare ecosystem. But at the end of the day, if those services are being rolled out, what financial impact it has on the consumer, because as I said, there are no free lunches. But yes, it's affordable. And by the way, the app is free to download. Please download that and try that out, right? So that's where we generally stand in terms of these partnerships.
Thank you. Just a pause on this. If you guys see the QR code on the corner, please send in your questions because we want to reserve more time for Q&A. So I'm just going to go into the next question about ecosystem effort, right? We know that this field continues to be very competitive, sometimes fragmented from different, providers to tech enablers, where sometimes we see, one's loss is another's gain, unfortunately or fortunately. And people actually operate in silos. But what I really love about today is that we are not in silo, where IHH actually brought us all together and break that silo. So how do you actually envision, all of you can collaborate with one another? We start from the data perspective. We start from, how this, as a provider, you can adopt. Maybe we start from Akiko and then we move to Kidit and Pauline.
So data, and this is where I actually do become a little bit more interesting. So as the innovation practice lead, we work a lot with companies and individuals who are interested in learning how to use their data, or experimenting, shall I say, how to use their data in order to create new solutions that solve big problems. It could be large businesses, it could be like startups, but that is the ecosystem. And the beauty of being Google is that you do work with everyone. So it's a really fascinating time, I think, to be looking at data. There is a question, right, of whether, the results are going to be better with more data, or is it the quality of the data, or is it, the model, right? So, and probably, everyone seems to disagree on all of these. Like what leads to a more accurate, faster, cheaper, better outcome? And that really, I haven't spoken to like two data scientists who who agree on this. Is it the model that really makes a difference? Is it the quality of data, or is it the amount of data? There's zillions of data today. first party, second party, third party, etc. So I think there is a lot that could be that is still yet to come, and we are really at this fourth wave of like an industrial revolution, and lots of things are going to happen. Just loved all the pitches, by the way, today. I will say, having spoken with my healthcare life sciences colleagues, that there are 2 use cases for Gen AI, for example, that have been just been constantly being asked for around the globe, regardless of the region, and that is probably 2 that are very familiar to this crowd. And one is around the patient management, and the engaging the patient on their in their journey. The second one was around helping the physician or caregiver's burnout problem by helping triage, shortening time durations, etc. So, all that being said, responsible AI is also a big concern for us. So, for all of us, as humanity. So, I think that's really like one of the big tensions that we need to manage as we move forward. And as an innovation consultant, I'm always going to say, experiment small first.
So in my past life, when I was leading business model innovation for a big pharma company, we were trying to establish a lot of big digital and tech partnerships. So I wear a suit such as this, and I fly to Hangzhou to meet Alibaba. Okay. I walk into their office. The guys meeting me in the other room, some barely spoke English, some of them were in board shorts. So I think the first thing, and the learning, was that we just need to start maybe coming to a common understanding of who we are and meet in the middle. And I realize I'm overdressed again today, and somebody pointed out that to me a while ago. So I think that's the first thing. But we're also looking at a few things, and this is really an opportunity, and maybe I'll try to couch it in terms of like 3 Ps. The first is really thinking about how do we truly measure outcomes in the real world and drive performance-driven care. Because if we're able to appropriately measure whether it's a medicine or a service that we deliver, then we can maybe evaluate the right models to pay for it. So I think that's one. The second thing, and we talked about a lot about data, about AI, and to me, I would couch that around really putting power in the hands of the different stakeholders in the ecosystem. We did a recent survey, and 70+% of consumers that we surveyed in Southeast Asia mentioned that they are actually willing to share their healthcare data as long as we can help these consumers derive better outcomes for care, number one, and that we guarantee that we safeguard that data. So a really important component is there's a willingness, but do we have the right safeguards in place, number one, because we do have the right technologies to start to interpret it. And maybe the third thing around this is, you mentioned trying to keep people out of the hospital, right? And building that ecosystem to say, look, the paradigm shift is moving from a person going to a particular location to get a particular care at point in time. We need to turn that paradigm around to say wherever that person is, the care can be brought to that person. So that's probably the third piece in really trying to stitch the ecosystem together, is shifting where that care delivery takes place and then utilizing the ecosystem and the technologies to be able to bring that to wherever that person is today.
Okay, I kind of agree with both Kidit and Akiko. So the clothes, right? Having this, I had to change because this morning I was at a very uppity event and everybody wore a jacket. I actually sort of asked if we needed, how should we be dressed today? And they said, oh, it's a startup event. Okay, so I brought something to change. So you're absolutely right. You've got to be in the same culture. First thing you think about when you want to find someone to collaborate with. So just to share with you my background a little bit. So I'm actually a scientist by training. So I spent a lot of time in basic research, and I always represented the tech push side of the house. And I I consider myself like passionate about change management, innovation. Like, why can't people just change, right? Why are they stuck in that system all the time? Slowly after that, I moved towards a job to build the ecosystem in innovation and entrepreneurship. So again, it's a little bit of the, like the startup vibe, trying to push, trying to encourage change. And just last year, I took over this job to try to do that for the healthcare sector. And lo and behold, it's a totally different culture, right? They want to change, but a lot of times they cannot. Why? Because there are years and years and years, decades of past medical history and safety and reliance that they have built up. And there is this fear of risk, right? What if you brought in a new technology and my patient's going to die in front of me? So there's layers and layers of all this having to plow through safety studies, clinical trial design, just to be sure that when they introduce a new technology, it's going to be for the better of the patients and not for the worse. And so, just in this 1 year, I realized that I needed to listen. I needed to understand what it is that they need. And they really want to innovate. They do. And oftentimes it is about helping them to, explain. It's about knowledge sharing and also helping them to unravel some of the processes that they are crippled with, right? But you can't just go in there and say, look, this is going to change your life. This is going to make you, your patients will get better soon. You don't have to work so hard. You've got to work with them. It's all about like understanding what they do, redesigning the whole process, and then finally implementing. So at the IHIC, we're not new. We've been around for like 8 years. And in the same way, we used to support innovation, like ideation, innovation, creation of new technologies, blah, blah. And then we bring in private sector partners to help commercialize it, blah, blah, blah. And then suddenly we realize, oh my God, all this, we created a mountain of new technologies, but they can't be used back in the hospitals that we created them for. Why, right? Because again, same thing, procurement, layers and layers of bureaucracy, risk adversity, all that is nothing to do with innovation, right? So how do we now walk through all these processes so that we can bring these innovations back into the clinical clusters, which is where it's kind of needed. Of course, going beyond that, I think Siddharth was saying as well, it's not about curative care anymore, it's also about preventative care. So we're not just talking about patients, we're also talking about individuals, how to make it work such that less people will get to the hospital. So you can imagine it's actually a huge, right? It's a very broad strategy we want to do together, but if you really drill down to the different verticals and the different horizontals, you must identify what is that problem statement that you want to work with the hospitals on, with the clinicians on, with the nurses, with the allied health and the community care people. They're all different. All have different cultures. All are looking for different things. All want that change to make their lives better. So there's lots of opportunities, but you've got to break down the walls first. Listen, understand, and work together.
Thank you, Pauline. Listen, understand, and work together. So listen. Thank you very much for those who have put questions into the Slido. If you have not, please do so that we can all learn together what are your key concerns. So I have a question here, it's, I think, a little bit directed towards Siddharth, because it's talking about what are the reimbursement consideration for healthcare innovation from a payer perspective. But I also like to hear, that other panelists to weigh in a little bit, from Pauline talking about, listening and whether public institutions is a better way to adopt this. So maybe, is that a bell for me? Gosh, let's start with Siddharth first.
Yeah, but can I understand the question properly? Probably I didn't understand what exactly the question
it's
was.
basically asking what are the payers' consideration for reimbursements?
For reimbursements of what? So whosoever sent the question, is it for hospitalization? Is it for, I would assume it's related to hospitalization, whosoever sent this question. You see, if you look at the traditional way a health insurance payer works today, reimbursement is based on certain terms and provisions of the contract, right? Because at the end of the day, insurance is a legal contract. Now, besides that aspect, which is obvious to all of you that, whatever is a part of that contract is payable, I think for us, outside of that, and I go back to the statement I made some 10 minutes back, is about what is the quality of care being delivered at that place? Is that entity, is that the healthcare entity something that we can really partner with and then ask our customers to leverage of the services provided there? Because at the end of the day, we are looking at quality outcomes. So reimbursement is about actual expenses incurred. That's what reimbursement means. Now, if somebody is utilizing a healthcare facility or healthcare services that are being promoted or supported by an organization like Prudential, we really need to be sure that there's a value proposition and whatever is being delivered is world class. Because that's the expectation of our customer who has ensured that they place their trust in us. So therefore, to answer this question very specifically from a payer's perspective, one, of course, when we are reimbursing, and I assume that this is about hospitalization because the question is like sort of open-ended. So I assume that it's about hospitalization benefits. So yes, one, it's about whether the legal terms, the policy conditions, and they are really supporting that. And two, we try our best that our policyholder really seeks healthcare services, healthcare provision from institutions that really are able to provide quality healthcare. And the punchline finally is that affordable prices, going back to what I said 10 minutes back, right? So that's what we really look forward to.
So what about the healthcare innovation, like new diagnostics, new digital solutions that comes into innovation? Would insurers be willing to pay?
I mean, look, at the end of the day, let's look at the pre-COVID times and post-COVID times. Insurers were very skeptical about even talking about telemedicine and paying telemedicine benefits, right? It was like most of the payers were not aligned to telemedicine and supporting telemedicine providers and even paying as a benefit. But today the world has completely changed. Everybody or most of the major players are already supporting, one, telemedicine payouts, two, telemedicine providers. And now we have moved to a level where our healthcare partners are basically providing, supporting us to provide digital healthcare services to our customers, and they are very much payable. They're very much payable. Now it all depends, like what product, what benefit. So that's a different paradigm, you know, because that's the structure of that benefit. But in terms of, are these partnerships happening now from a digital healthcare perspective? The answer is yes, absolutely. And insurers are now really looking into moving towards this digital healthcare space where this would further enable the growth of their business. So this is the future, definitely. But as I said, healthcare is not digital. Digital healthcare is what enables the growth of healthcare, what enables the customer experience. And these are two different things.
Any other panelists would like to weigh in?
I'm going to weigh in from the government payer point of view because it's really a reality. I mean, for most of you who have lived in Singapore for a long time, I think we're very privileged to have a great, reliable healthcare system, but it's not free. I think you mentioned, right, someone pays for it, right? You just, maybe you don't see it. So Singapore, for most of you, you probably know this, Singapore grew from like a mud flat in the 50s with nothing to a metropolis now with most of the status of a first world country. And that comes with a price, right? Because its people expect for healthcare really, really quality healthcare. And this is one of the conundrums of a developed society, because then you probably have to pay higher tax to enjoy great healthcare. So Singapore is going through that transition where like the government can no longer continue to pay for everyone to have 150% sort of healthcare. There must be a way to become a little bit more sustainable. So we're looking now at cost effectiveness and value-based healthcare rather than just quality healthcare. So this is actually where technology can come in and help, right? Because if you find a way, like say for example, if you bring AI in, I think one of the startups was presenting just now, like if you can bring in AI to cut down the processes for radiologists to run through some of the images, then perhaps the cost of hiring or the cost of processing the images may come down. And so in order to get your data, your readout maybe you don't have to wait so long and you don't have to pay so much. So we're actually looking for opportunities like that to reduce the healthcare cost and the healthcare burden, so that over time we can continue to have high quality healthcare, but not have to pay so much. Because at some point, there will always have to be an out-of-pocket expense from every single person in order for the healthcare system to be sustainable. Yeah.
I just want to add to this, Pauline, absolutely right. And this is where probably we as the payers on the private side are lagging a bit behind, because we're still looking at what value-based care is going to bring to the table. We don't have the expertise yet to really, dabble in value-based care, if I may use the term. Sorry for that, for the lack of a better term. But we're really keen to hear how the government could come and help us on that, right? Because at the end of the day, this fee-for-service model, I don't know how long this is going to last, how sustainable it is, especially in a market like Singapore, where healthcare inflation is really very high, right? So at some stage, maybe we'll be talking about how do we get that into the payer's dictionary, right? And use that as a model for reimbursing. So coming back to your question, I'm just trying to link that back up, right?
Thank you. I mean, when we talk about paying, we have a lot of startup representatives here. There's always a struggle of revenue generation versus really delivering innovative healthcare to, value-based. Be a question for Akiko as well as Kidit. This is what do you think, as a startup, should you think about revenue generation, or you should think about, getting this to the mass market to bring value proposition for public healthcare? Of course.
I think there are like two different questions there. Like one was, so from a startup survival, right? So,
Exactly.
I mean, if you're not solving a problem, right, nobody's really going to be interested in using it. In which case, even if the patient or the customer or user is not going to use it, then you're stuck. Like revenue generation won't even be a question. So to me, it's not really like a question, or like there's not tension there if you're a startup. But the actual question being asked though was like, was there like tension between, what was it? The
Innovation for patients.
innovation for patient care versus innovation for revenue generation, right? I mean, I think the world is actually big enough that both can exist, hopefully. And I wish, please approach me after this, because I feel like that's a really abstract question.
It is a tough one, but maybe just a few points. Like if you look at pair therapeutics, for example, great technology, FDA approved, but zero adoption. So going back to your point, I think when you think about focus on the user need and the problem that you're trying to solve first, and understanding that, and things will follow, right? Because if you focus on how great your technology is or how great your business model is, but you don't really understand the customer, at the end it will fall apart. So just be as customer and user centric as possible is probably one thing that I would say, and then the rest should follow. Now, obviously, from a survival perspective, you want to get the revenue or cash flow positive as soon as possible. But I think that is an effect and an outcome of understanding your customer, of having your service or your technology differentiated enough, and being able to deliver on what you're promising. Because if you do those three things, the revenue will follow, or should follow.
Just to add to build on, do a yes and on that. So even if the people who are really trying to, you're focusing on, right? If they're not the ones who are paying, do you have enough people, or do you have like a niche, or like are you hitting a problem that is big enough that eventually somebody will pay to access those people, right? So that would be, so if the question is which comes first, then totally agree, like focus on the user or the customer or the patient first, and all else should follow. But again, as we all know, the road to yeah, is quite bumpy. Yeah, but we all aspire. Yeah.
Thank you very much. With this, I think I ran out of time. Please join me to thank my panelists again. Thank you for your sharing, very thoughtful.